We told you about this story last week. A Katy boy who was largely nonverbal for most of his life. Well, his family thought it may have been from a developmental disorder, but a dentist found out he was tongue-tied. Omar Villafranca has Mason's reaction.
Was this kind of communication even possible?
No, that's fine.
This was not our life.
Mason Motts doesn't care that grown-ups are talking.
Because
That's me.
That's you.
Because now he's the one with something to say. His parents, Meredith and Dallin Mott, say last year the 6-year-old could barely speak.
The beginning of words, not the end of words. Really poor enunciation.
Nice job, Mason.
The Texas family chalked up Mason's speech problems to a brain aneurysm discovered when he was 10 days old and to a developmental disorder. But early last year, their lives changed when they went to KIdstown Dental in Katy, Texas. While working on some cavities, Dr. Amy Ludeman-Lazar noticed that Mason was tongue-tied.
And you see how close it is to the tip?
She saw the band of tissue under his tongue was connected much closer to the tip than normal, which makes it harder to talk. She asked the parents if she could do a simple procedure and use a laser to cut the tissue.
No cross bites, no crowding.
how long did it take for you to do that procedure with the laser under his tongue?
Maybe 30 seconds.
That quick?
Yeah,
And the results?
are life-changing.
Studies have found the condition is prevalent for between 4 and 10% of infants.
Can I have a pizza?
And for Mason, the small fix made a big difference.
How quick did you start noticing things?
That evening,
What was one thing that you noticed immediately after the procedure?
instead of pointing to food or pointing to his mouth, he was able to say, "Mama, I'm hungry."
I said, Dallin, get over here. Like, Mason, what'd you say? And trying to get him to say it again, and he's just like. What'd you do at school today?
I was doing science.
The Mottses say Mason is catching up verbally, and they are grateful that their miracle worker
And let me take
happened
a
to be
peek.
their dentist.
This wasn't on our path. Our path was, we need to get his teeth better.
When you see a case like Mason's, what does that do for you professionally?
That's why I come to work every day.
For CBS This Morning, Omar Villafranca, Katy, Texas.